So an early thanks to Mary Beth and Scott, who are both in the room, John, Matt, and Anna, who are not. So I'm going to very briefly give some background on alcohol outlet density. We've covered a lot of the background already on alcohol excessive use in particular. And then next, talk about a city-specific pilot we're taking statewide and give a high-level review of a dashboard that we released. We'll finish up with some next steps that we're taking. Also flag that I've got a couple of slides saved, so we'll see what we need for questions. But I'll try to also mark those, like I have more on this later if you're interested. Ask me questions about it. Okay, so some brief background. Excessive alcohol consumption is bad. That's about all I'm going to say about it. There are many pathways here. It's a room full of the choir, so we've covered it a couple times. Those include community harms, family relationship harms, workplace harms, as well as direct health harms. On the direct health harms front, though our shop does a lot of opioid overdose work, among other overdoses, I'm glad we do, there are more alcohol attributable deaths than all intents for all other poisonings, just to kind of keep this in context. But alcohol is legal, and its harms are more so normalized, but it's worth working on. So we'll come back to this logic model later, which came out of the dashboard work that I'm going to end with. But broadly, it might be useful to think through this lens on the alcohol outlet density piece, that lower alcohol retailer or outlet density plus better alcohol control strategies leads to lower overall consumption, but also lower excessive alcohol consumption, and that's where we get the reduced negative health outcomes and reduced economic costs. So as a concrete example, there's a paper from Zhang et al. In 2015 that saw first defined alcohol outlet clusters in Atlanta and saw a reduction in alcohol outlet density in one cluster led to a substantial reduction in violent crime in that same cluster. And we can talk about sort of how they actually reduce that alcohol outlet density over time. But I'll also flag that this is one of many measures I'm going to introduce during the talk, because there's lots of ways to measure alcohol outlet density. So speaking of, the CDC soon after that released a guide on how to measure that outlet density in three main techniques. Our studies, we've done all of these different techniques and some more. Each have strengths and weaknesses, and I'm happy to share more about those techniques at the end if you've got questions. So onto the Durham pilot and then the state work. So first, a little geography. Durham is confusingly both a city in North Carolina and the county that city is in. So I'm going to use it in the Durham County sense, but it is a city and a county, and both are Durham. And that's where our pilot started. So a few things to know about alcohol outlets in North Carolina. We're in the minority of states as a control state, meaning a state control state, meaning among other things we can get a complete database of licensed alcohol outlets from our ABC board. That's great. Not every state can do that. I'll flag again for questions for later. There are other ways to get alcohol outlet data that I can elaborate on if you're interested. And two, broadly we looked at on and off-premise outlets separately. So if you're new to this work, the short version is an on-premise is a restaurant, and an off-premise would be at a gas station or an ABC store or something where you're going to buy, leave, and drink. You're not going to be standing on premise and doing that. And that split is partly because there's plenty of evidence that suggests they've got both different community health associations as well as are in different areas. So these are really both spatially patterned differently, and the outcomes and sort of everything about them are different. And lastly, all this was done with free open source tools. Those that know me know that I'm a huge R lover, where we did all this analysis sort of start to finish in R, though I think the RD stuff was done in SAS. We'll get into that. But all the spatial stuff is done in R and QGIS. So on to the measures. So a local nonprofit got us started in Durham, and they were doing a container-based analysis. And the long story short here is that the example would be the number of outlets per population in a census tract. And sort of, you think what's in the container, and you do that math that way. There's other alternatives to that that are a little bit more flexible, but that's what they did. In this case, they used police districts for their analysis. On our end, we first built alcohol outlet clusters for Durham, and that was requiring 5 or more outlets per cluster with at least a 0.15 mile buffer. That was adjusted from the Atlanta definition to our specific city of Durham, and again, I've got a couple slides on how we chose that. But for now, we drew some boundaries around some clusters and looked at the demographics of who lived there. So here you see Durham County demographics in green on the left, compared to the demographics of who lives in these on and off-premise alcohol outlet clusters. So those living in high-density off-premise alcohol outlet clusters were disproportionately Black and Hispanic in Durham. These disparities extend to other measures too. Yeah, you can sort of read that. Not just to clusters, so dropping the clusters and just looking at who lives in Durham. The table at the top is the same as the prior graphic. The next two tables show two other measures, whether considering the distance to your nearest retailer or a spatial exposure index that looks at your distance to a bunch of retailers at once. Black and Hispanic individuals in Durham were exposed to a denser alcohol outlet environment in general, as well as particularly off-premise environment. So for instance, from the second table, Black and Hispanic residents live about half a mile to their nearest retailer versus about 3/4 of a mile for white non-Hispanics. And this spatial exposure index, again, combines 7 outlets into one measure, and I've got a slide on that at the end if you want. So where do these disparities come from? Well, Durham's got a rich and neighborhood-specific history, including being a center for what was called Black Wall Street of the South, a socially active local credit union, some really cool history. However, it also has a history, like many cities nationwide, of racist and exclusionary land use decisions. So one of these practices, among others, is redlining. That's the practice going back to the 1930s of actively denying home ownership loans in Black communities. This is 1933 homeowners lending corporation maps that were drawn. And that's a 1933 map on the right. So more broadly, that is a measure of systemic disinvestment in communities over time. I mean, this was not just residential homes, but also sidewalks and everything else. So sure enough, in Durham, the largest off-premise alcohol cluster in 2017, and that's in the inset, that's the purple line shaded one, overlays the lowest homeowners loan corporation D-grade neighborhood in Durham. So this, 2017 overlay with 1933. And this isn't just specific to Durham. We could go to the 5 cities in North Carolina that do have homeowners loan corporation maps, redlining maps. And this finding extends generally statewide. So more populated C and D grade areas, saying like don't lend there, basically turn that residential area into a commercial area historically over time. There's a couple other mediating pathways there, but that's what that's about. Those areas have a higher off-premise index, and again, I could almost swap that measure with any of a couple that are going to show something pretty similar. So this would be modified by gentrification in some cities, as well as present-day dynamics, but seems to hold well in North Carolina. And a plug to later, we do have nationwide redlining data if anyone else is interested in this frame. You don't have to do this if you're thinking about disparities, but it might be useful for local stories. Durham was using redlining data to tell the story, and alcohol outlets were part of that story. So redlining aside, cities can have very specific alcohol outlet stories. Here we're looking at the average distance to your closest 10 outlets, is the measure chosen here. And you notice that Chapel Hill, where I'm from, hard to read in the bottom left, has a much more dense environment than Wake Forest or Huntersville, as you're getting the average distance to your closest 10 outlets get farther and farther, given the same population on the bottom. So, a lot of spread for the same population and how dense your alcohol outlet environment is. So we considered the pros and cons of all these different metrics and then wanted to get a dashboard out to people to use this in local messaging. So even though the statewide analysis is continuing, and particularly the density associations with negative alcohol health outcomes, we flagged as sort of an important next step, we wanted to get this data out. So I also flagged that a particular interest statewide right now because there's some legislative interest in privatization, which, spoiler alert, is the one thing the CDC does not recommend, without talking about that specific piece of legislation, which I can't. I can say that we are very clear on what policies broadly are useful and not, and that is the one on the CDC's list that they say do not do. So our alcohol outlet dashboard work, though it became more than just alcohol outlet density, was built on the heels of an opioid dashboard that we're a year and change into, and that was built in R Shiny. And is going to benefit from our lessons learned here. So this time we're transitioning to Tableau as a front end with R as the back end instead of having R do everything and build the website from scratch. I'm happy to answer questions on that since that was me, but in this case we're doing something a little bit different. And again, there's some pros and cons to the tools here. That's a good question if you're interested in it for later. So a few changes. First, we're taking a much more curated approach to the data, really walking readers through a story as we see it from the public health side, and that's a big, I'd say, change from presenting the data in a bunch of sheets, even with some narrative background for each of those data points. And that's partly how we came to this simplified logic model, is that we wanted them to take away this from our data. Second, we're moving to a Tableau front end with our back end, as mentioned. Again, pros and cons there. And lastly, we make a lot of reports, a lot of one-pagers. And there's been an effort over many years to try to consolidate our deliverable output. So this dashboard will also print well in a PDF that's a one-pager, and you can swap your county and print it. And so we want to try to do the whole two birds, one stone thing. So the final layout looks like this. This is me printing the dashboard as a PDF, though this is interactive on the web. We'll do a deep dive in just a few of these pages for time, but I'm happy to answer questions on others. So yeah, big picture, we've got a welcome page with a YouTube video that introduces the tool, then an overview sharing the logic model and the framework, which we've talked about. We get right into what we do about it, so the public health strategies from the CDC guide, which will be one of the deep dives, and then into density. After that, we talk consumption, short-term, long-term impacts. We thought was a useful way to split that. We talked about, do we do it by age? Do we do it by what? But it's short-term, long-term, and age sort of maps with that. And then we get into cost and a data dump if someone's interested in the bibliography. So these are the metrics that we're using. We actually squeeze a lot of data into this. Most of this is drillable down to the county level. The outlet data is in bold at the top. That's total outlets, the count of on and off premise outlets in your county, the rate of those outlets per person, and the max rate for any track in that county. So some places in particular are much farther from that center for the county, and we wanted to demonstrate that some places are exposed to much more than the average. RD we built, that's the alcohol-related disease impact. This is an upweight so that it's not just direct deaths by alcohol, but an upweight of certain subsets that we know are, what percent of cancer is alcohol related, what percent of whatever. So that analysis was done to drill that down to the county level. And that's a reference on that at the end, stare it all. Economic costs we had statewide, and we proportionally distributed that into counties by population. That's not perfect at all, but it's not zero. And again, on the trying to get some data in is probably better than no data. So some early outcomes. The dashboard's going well. This was a month, 6 weeks ago or something we put it up. We got 2,000 views in the first month. That was great. County feedback is very positive. I think I was personally most pleased to see a local paper basically walk through our narrative. Just pick up the narrative start to finish and grab phrases, and it was clearly modeled after our frame, which is very exciting. So the dashboard, in a way, in the redesign, sort of served as a press release in a way that they could just pick up and swap their county and then tell that story. We found that was really useful. Okay, so a couple of pages we'll zoom in on. This one, can't read the text on the page, even worse there than it is for me. But big picture on this is the public health strategies page. Scraped off, happy to elaborate on how we did that. Got the data out of the community guide into a sort of a machine-readable format. I just wanted to flag that this is not a typical way that I think about presenting data. You have one. The only thing we say not to do is privatize alcohol statewide, and I have a whole thing about that, a whole page dedicated to that single graphic. But that's an important point that we wanted to make. And alcohol outlet density, you could select your metric, do a mix of live text and static text there. This one had a little bit more static text than others. Then when we get into this, I shouldn't say outlet density. That should say, yeah, the public health impact. This isn't density anymore. But this one, we swap out all the text on the page. So you pick a county and it just pulls the text and highlights it out. We had a couple of call boxes that don't change, like there's a Good Samaritan law, FYI. It's drug and alcohol poisoning for our state. And then the last zoom I'm going to do is the community costs, where again we interpolated this into counties. Data dashboard page is much more what we've been producing in a way, just sort of a flat data dump. And we do have folks that want this. They can also get the underlying data from the dashboard if they want to, since it's all public once we've done all the suppression and stuff. So last slide on next steps. The Durham paper, the pilot is under review. maybe someday it'll leave review and get published. We've got some other papers in mind to continue statewide disparity analysis, and there's current legislation we're really interested in because that'll change our landscape pretty dramatically, potentially. And then there's opportunities here. So anyone else want to combine outlet data, talk about redlining together, improve nationwide outlet surveillance? Let's keep talking. So that's it. So questions, a few minutes, I think.
We got 4 minutes for questions. Get right up.
Hello again.
Hello. I'm with the National Alcohol Beverage Control Association. For those of you who don't know what that is, it is a trade association for alcohol regulators. And all I can say is kudos to North Carolina for creating such an impressive dashboard. I would be remiss if I did not come up and sing your praises, because many of the alcohol regulators I work with have, sent me emails saying hashtag goals once they saw this data dashboard, saying we need to bring this data to life in our own state so that we can protect the kind of alcohol policies and safeguards we have in our state, like you have here in North Carolina, regarding a control system.
Thanks.
And so that's just a general comment. But in another comment, I would just say for your Durham friends to think about, as putting my resident hat on in Baltimore City, we work on this same issue, and we have a lot of density of liquor stores in residential areas and primarily in low-income minority neighborhoods. And one of the frames that has helped us in that, and just pass it on to your Durham friends, is to look at grocery stores, what children have access to in those same neighborhoods. So in Baltimore City, 60% of children have access to a grocery or liquor store rather in their within 1 mile within a quarter mile. Let me just read this. I think it's powerful. All right. An estimated 60% of Baltimore City public school children have at least one liquor store within a quarter mile of their home, while only 13% have a grocery store within a quarter mile.
Yeah,
that's
great.
Powerful data that can bring that story home to a legislator, perhaps. So just a framing suggestion for Durham if they have that kind of piece to look at. So
Yeah, that's great. So there's a local nonprofit centered in Durham, only doing Durham work, and that kind of material is what they're producing at the local level. They had kids visit every alcohol retailer and ask them to do better, and they have the data on sales to underage folks that they're incorporating at a local level. So it's really, we want to make data for local partners, but then you can do a lot more at the local level. I'll also flag that to your question from 2 presentations ago, some places do YRBS locally, and I'm involved in North Carolina districts that do upsample YRBS locally so they can get local data. If you have questions about that, we should talk. Any other? One more question? Yeah.
Hi, I'm Julia from Oregon. We've used the alcohol outlet density guide to look at cannabis outlets.
Mm-hmm.
And of the 3 measures, the container-based, proximity-based, and then spatial access density, we've kind of struggled with communicating to stakeholders about the third one. It's sort of hard to explain.
Yep.
And I just wondered if you had any thoughts, since you're working on communication, if you have any thoughts about the value of proximity versus spatial access density, and any suggestions about how to communicate better on that third one.
Same problem. If I had to, I think probably there's a balance between what's useful for causal inference, like what we think is actually the association that's the most difference, makes the most difference in terms of health, and then what's communicable. A measure that I put on here is a balance of those 2 things, which is your average distance to your nearest 10, rather than 1 over the distance to your nearest 7 or something. And so average distance to your nearest 10 retailers might communicate better than your distance to your nearest retailer, while still gathering some of the spatial index benefits of looking at more than one at once.
Okay, so you adapted that just a little bit.
We had to bend it, and again, I'm not sure yet. We'll see, but feedback will help us on this.
Okay, thank you.